Hello everyone. 안녕하세요. 사와디카. 찬츠 이엘리. I know this is my last presentation of the day, right? So I will keep it brief as much as I can. So I'm Mihyeli from Yuan Dermatology Clinic, and I'm going to talk about glass skin, which is becoming a global trend. So I'd like to say about the glass skin, its definition first from the optical perspective, and the treatment as the multimodal approaches to achieve this look. So my talk is divided into two parts. In part one, I'm going to talk about the optical definition of the glass skin, and we need to understand how it differs from just having a glossy skin with cosmetics, right? And in part two, I will introduce various treatments using my personal favorites as well. So let's define glass skin first. So K-beauty is, especially Korean glass skin, represents radiant and luminous skin. This is a skin type that many Koreans prefer, and it's now gaining global attention. Our clinic is also sees many international patients as well, and many of them specifically ask for Korean glass skin. So then, what is glass skin? In the past, terms like honey skin or dewy skin or water shining were mostly subjective marketing words focused on surface glows. However, as patients care more about texture, transparency, and radiance rather than just wrinkles, we need a scientific definition. So let's look at the optical properties of glass skin as a goal for dermatological treatments. So first, let's look at the optical interaction between light and skin. How does light interact with our skin? When light goes into the skin, some is reflected off the surface, but some penetrate into the skin, and inside some of it is scattered and returns back to the skin, while some is absorbed by chromophore. And in the right image, the most important concept here is that skin is partially translucent. Translucent materials have a property where light is scattered internally. So, and a part of that light returns to the surface. So when the light enters the skin, different things happens at each layer. At the stratum some light is reflected at the surface, and some of them passes into the skin. And inside the skin, sunlight is absorbed by chromophores such as melanin and hemoglobin. And sunlight is scattered, then reflected back, and finally reaches our eyes. So if we divide light-skin interaction into surface and subsurface, we can better understand the optical definition of glass skin. When the surface is smooth, light reflects at the same angle as it hits. This is called specular diffraction. And in the subsurface, we need enough scattering and reflection so the skin looks clear and radiant. And there are four main optical phenomena in light-skin interaction. The first is surface reflection. This happens at the outermost layer of the stratum corneum. When specular reflection is strong, the skin looks glossy and shiny. However, this doesn't include information from deeper skin. The second is scattering in the subsurface. This determines skin opacity. So the key insight is that the transparency of glass skin is not from specular reflection of the surface, which is shine but only contain the surface information, but from the diffuse reflection where light penetrates deeply, backscatters within the skin, and is reflected back out through the surface. So the third is absorption. In the skin, chromophores like melanin and hemoglobin absorb certain wavelengths. This reduces skin brightness. And the last is subsurface reflection. This is the light that survives scattering and absorption in the dermis and returns back to the surface. So the light creates skin transparency and true luminance. So in conclusion, the optical definition of glass skin is strong specular reflection and in the subsurface scattering and abundant backscattering and reflection in the subsurface. So according to a study examining human brain activity related to facial attractiveness derived from skin reflection, people can actually distinguish between these two very different types, the oily, shiny, and radiant skin. So oily, shiny skin having high specular and low diffuse reflectance, but radiant skin having high specular and high subsurface dermis reflection. So people can distinguish these two things. So we have defined the main component of glass skin. So now in part 2, I will talk about treatment methods, including some of my favorite procedures. First of all, glass skin treatment doesn't mean a fixed protocol. It requires a tailored and multimodal treatment targeting each optical component. There are 4 main factors. First is hydration, and second is surface irregularity, and third is dermal collagen and ECM, and 4 is reduced dermal density. So let's see one by one. The first approach is hydration. If we hydrate the skin, more light can penetrate through the skin and it looks more clear and glass skin. And one commonly used treatment is polynucleotide injection. Also, skin barrier damage itself causes some optical losses. So treatments like PRP or skin boosters can help patients with a damaged skin barrier. So one well-known treatment is polynucleotide in Korea. So it improves hydration and texture and reduces redness and sensitivity, and helps with wound healing and scar remodeling as well. So studies show that combining PN with non-cross-linked HA gives better recovery than PN alone. So in my practice, I mix these two and use them under the name of Radiance Booster, named after my clinic. And the second strategy is surface refinement. Making the surface smooth is actually the key concept of the glass skin, comparing the two things. So this includes peeling and improving surface irregularity using many modalities targeting each of the skin problems. So and sometimes deeper volume loss, like that picture, sometimes it can cause optical defects. So sunken area must be corrected to restore specular reflection. And botulinum toxin for muscle and skin can be performed as well. So now let's look at intradermal botulinum toxin. It's called skin Botox or baby Botox or micro Botox. I think in Korea, rather than conventional Botox targeting the muscle, this kind of intradermal botulinum toxin is more widely used. And skin Botox has been reported improving the sebum production and pore size and redness and wrinkles and textures. So combining it with, but it doesn't improve hydration. So combining it with PN and HA treatment is a good strategy. The total dose for the whole face ranged from 30 to 200 units. And in this report, even when a total of 200 units was used, no side effects were reported. But in my practice, I consider that the toxin can spread and affect the nearby muscles. So we can preserve natural facial expression while improving fine wrinkles, which often gives a better result. And for the forehead, direct toxin injection for muscle can cause discomfort, such as ptosis or heavy feelings. So in those kind of patients, intradermal toxin can be an option. And the next is color. Pigment and vascular lesion cause uneven spots on the skin, and it will act like an optical void in the picture shown in the right side. And you may all have your own preferred devices in your clinic, but in my personal protocol, I usually combine 164 nanometer and 532 nanometer, and sometimes combining with ergonomic or other ablative laser. And I also use an ampoule called Radiance element as a routine part of our pigment treatment. Radiance element, as you already heard about the previous lectures, but it's one of my favorites because it contains a high concentration of 4 active ingredients: glutathione, ascorbic acid, and niacinamide, and tranexamic acid. And these molecules can penetrate the skin through the passive diffusion, and it can facilitate this penetration using other laser-assisted drug delivery as well. And the final target for glass skin is the dermis. Dermal density is the main factor for subsurface reflection. And collagen fibers are the primary scatterers in the dermis. And you can use your own devices. There are many treatments for this, including various Ebds and injection. And one of my favorite is super technology. I will talk about it a little more. And as shown in this diagram, we can stimulate the dermis using a variety of devices. And Sulfate uses super technology in the right side, and I think because of its unique property compared to other devices, such as compared to the ablative laser, the super technology can preserve the skin barrier itself, and also compared to the RF microneedling or HIFU, it delivers energy to the wider area compared to the dot point area. And compared to the bulk heating RF in the below, it clearly spares the epidermis. So safety is better. For this reason, I personally think it is one of the most effective devices for stimulating dermis with safety. So now, let's look at some clinical photos to see how I actually use tailored multimodal treatment. This patient first came with the first condition, and over time, as I repeat the treatment, the skin gradually changed and looks more like glass skin. Can you agree with me? And I corrected, first of all, deep sunken line with fillers and treated atrophic scars and pores, and combined with treatments such as skin booster and Botox. And as time passes, the optical defects decreased, and the skin became closer to glass skin. And the next patient is Korean living abroad who visited the clinic for a few months while staying in Korea. So based on the consultation, I considered the patient had very sensitive skin. So I made a treatment plan with skin barrier repair as my top priority. So with the first session, I did some BB and facials, and second treatment, stem cell treatment, and booster injection. And the third treatment is a yearly treatment, ultraviolet and sulfate. And the feedback was especially positive after the second visit. So since skin barrier damage can cause multiple optical problems, such as dryness, redness, and chronic inflammation, so barrier repair can sometimes be the main focus in glass skin treatment. For this patient, I combined microneedling, pico, fractional laser, and PDLLA cannula injection. So you can see the skin becoming smoother and more radiant as the texture improves. And the next case shows a patient right after the monopolar RF treatment. This demonstrates that glass skin can also be achieved by stimulating the dermis even without surface treatment. So no matter what device you use, if the dermis is properly stimulated, thermal effect can change collagen structure, increase subsurface scattering, and make the skin look more radiant and luminous. So this is my final summary. Now you know the optical definition of glass skin is the smoother surface for optimal specular reflection, even skin tone to uniform light absorption, and a healthy dermis with sufficient collagen for abundant subsurface scattering. And in practice, glass skin is often used to describe a dermatologic goal that is very similar to healthy skin itself. To achieve this, we need tailored multimodal treatments to address each patient's unique optic deficit. Thank you for listening. 감사합니다.